Hi, I'm Austin Atwell, and this is my applied reflection for creating system results for HCA 420A. So, how do we use systems properly? Well, it's important to create a direction for the system. It's important to create improvement goals for our systems. And it's also important to create systems that foster collaboration and teamwork. How do you establish a system direction? System direction involves three main roles. There's mission, vision, and context. A mission statement defines a system's identity. To create a mission, you must first identify purpose. So the purpose of our system is to help people in a home healthcare setting. Let's say that. Once a purpose is identified, you must set a direction. So the direction would be we want to increase the usefulness of the systems for these people in home healthcare to increase their healthcare outcomes. And that is our mission statement. Vision. A single health entity can have many visions or just a single vision. A good vision will provide a goal for the future that can be used by the organization, and some visions are even large enough to reach across multiple organizations. Example of vision is the goal to increase health outcomes among cancer patients. This can be used by many organizations that deal with patients who deal with cancer patients. Context. Context is complex and it can change over time depending on what it's relating to. Context creates management boundaries within an organization. So you can have a manager at the lowest level, and then you'll have a middleman manager, and then a manager at the highest level, and they all have their own context on how they're going to manage the organization. These managers allow employees to improve themselves by providing them with all of the tools, knowledge, information, and competency that they'll need to make sure that their patients have the best care possible. Setting improvement goals. It is important to understand the different types of goals and their uses. Goals can be advantageous and disadvantageous. A manager must be able to create goals for their organization that are more advantageous than are not. So certain types of goals may be useful to your organization, and some goals may just suck up resources and be even unmeetable. It might be impossible to meet a goal, and that's just not good for your organization. A goal statement. To create a goal, you must first state what it is the goal is going to accomplish. A goal statement should be complete and focus on a distinct goal that can be reached. A goal statement should address how quality will be increased through the goal. So, what are SMART goals? SMART goals help to create a useful goal. SMART stands for specific, measurable, achievable, relevant, and time-sensitive. Goals should work towards a specific need for the organization. A goal must be measured so that the effectiveness is able to be understood. You have to understand how a goal is affecting your organization for it to be used. If you can't understand that, then it's not really a goal. You're just shooting stuff at a wall and you're not getting anything. A goal must be achievable. Unachievable goals will just waste the resources of the organization. A goal must be relevant to the organization so that health improvements can be made. If a goal is not relevant to your organization, if you run a health organization and your goal is to get worse food into the cafeteria, terrible goal, but it's a good, it won't help anyone. Goals must be time sensitive to increase health improvements as much as possible. A goal to increase the number of staff before the flu season will be useless if it is started too close to the flu season. That'll make it impossible. It'll make it impossible to measure. It also won't make it relevant, because if you started too close to the flu season, it's not relevant to try to hire more people when it's just not going to happen. Collaboration and teamwork. Very important. Managers must be able to use proper team design to encourage collaboration and teamwork. This can be accomplished through shared team expectations, role definitions, and proper communication. Team expectations. A team must know what is expected of them and have this information available to them so that they're able to look back at it and you're able to show them that they knew that this was what was expected and they need to step it up. This will lead to a team that works together to reach the goals of the team, because they understand the expectations. It is also easier to tell members of the team what they need to do to meet these expectations, because they already know what's expected, and you can, once again, show them, hey, this is expected of you. You need to meet these goals. The entire team is working towards it, so let's step it up and work together and get this done. Role definitions. It is important to find roles within an organization. This allows staff members to understand their individual expectations so that they are able to work together to accomplish goals as an entire team. A certified nurse assistant must understand their role so that they can assist a nurse correctly. This will help a nurse to understand their role so they can assist a doctor correctly. All medical staff must understand their role to increase these patients' health outcomes, because when they all work together and they understand what they're supposed to do, then they don't step into anyone else's boundaries of what they do, and they don't mess anything up, and they lower risk, they lower anything that could lower a patient's health outcome. The biblical perspective. The plans of the diligent lead surely to abundance, but everyone who's hasty comes only to poverty. Proverbs 21:5. It is important to not only set goals, but also evaluate goals to make sure that they are the most effective goals to help patients. We must always be looking to improve what we've done so that we can work on it and hopefully work towards the abundance and not the poverty in patient health outcomes. Conclusion. Goals are important to all organizations, but in healthcare organizations, they must be very selective when deciding on goals because patients' health is involved. When resources aren't infinite, goals must be chosen to best use the resources at hand. This way that all patients will experience the best health outcomes possible with these goals that are set and achieved. This is my resource, and you have a great night.